Let's talk about gestational diabetes. It's a tricky condition because you often can't even see the symptoms.
So here's the weird part. You feel totally fine, but there's a hidden risk to your pregnancy.
So what is it? Basically, it's high blood sugar that first shows up when you're pregnant. See, hormones from the placenta can kind of mess with your insulin, making it less effective.
And that's why it's a silent danger. You feel great, but it's still affecting you and your baby.
Okay, so what does this actually mean? Well, the risks are different for both mom and baby.
For moms, we're talking about things like high blood pressure or a higher chance of needing a C-section.
And get this, it means a 7 times greater risk of developing type 2 diabetes later on.
For the baby, the big concerns are their birth weight and keeping their own blood sugar stable after birth.
Now this is serious. Uncontrolled, it carries a risk of stillbirth. That's why management is so key.
So if there are no symptoms, how in the world do you even find it?
Well, there's a really specific window for a screening test that pretty much every pregnant woman gets.
It's called the oral glucose tolerance test, and it shows exactly how your body is handling sugar.
Now, if you have certain risk factors, your doctor might want you to get tested even earlier.
But once you know you're in the driver's seat, there's a clear plan to take control. And it really just boils down to a simple 4-part plan. Nothing too crazy, just consistent steps.
First up, diet. Think smaller meals and less sugar. It's all about keeping things stable.
Then you'll add in some gentle exercise and check your blood sugar often. That data is your superpower.
And hey, if that's not quite enough, insulin is a totally safe and effective option for both of you.
So what about after the baby arrives? Does this whole thing just go away?
For most women, yep. Once the placenta's out, blood sugar levels usually go right back to normal.
But it is super important to get retested after birth and keep up those healthy habits.
Really, managing it now is a huge investment in a healthier future for both of you. Of course, this is all just for information. Always talk to your doctor for the right plan.